Hello friends, I'm José Mompell from DL Oral Surgery, and together with my partner in crime, Dr. Juan Lara, we're going to share with you this video today talking about infections and antibiotics. Let's go with it. As you already know, the oral cavity is the most contaminated one in the whole human body. Okay, so when we do surgery in the oral cavity, when we do surgery in the mouth, the possibilities of infection are quite big. So taking or prescribing antibiotics to our patients, it becomes, in our opinion, absolutely mandatory when doing big surgeries, big augmentation surgeries. We all do surgery, and we all know that infection may occur after one of our surgeries. We all have the experience of an infected patient coming to our office after 5, 7, or 10 days. In our opinion, it's absolutely mandatory to know different protocols on how to use antibiotics, how to prescribe them in order to prevent those complications to occur. Because you have to know that an infection in a grafted area or an implant area may lead to a complete nightmare, may lead to a total or partial loss of the grafted material or the implant place. So we want to share with you our protocol. You may have your own protocol, you may follow someone else's protocol, that's absolutely fine, but we want to share with you what we do in our daily practice. There are a lot of colleagues that have sent us emails or messages asking about how we treat or how we prevent infections, and that's why we want to share with you this, our protocol. First of all, we have to know if our patient has any kind of allergies. Why? Because it's been reported in the literature that those patients allergic to penicillins are more propense, they tend to infect more than the ones that are not allergic to penicillins. Okay, so that's the first question we have to ask to our patient and to ourselves. Is our patient allergic or not? If our patient is not allergic to penicillins, we're going to prescribe amoxicillin plus acid clavulanic. Okay, we know that some of you are thinking about, it is absolutely mandatory to associate amoxicillin with clavulanic acid. No, but here in Spain we have a lot of resistance to penicillin. Many patients have abused of those kind of antibiotics, penicillin, and we need to associate those beta-lactamases to prevent infection. Okay, and why we said prevent? Because prior to our surgery, 1 hour prior to our surgery, we prescribe 1 dose of amoxicillin clavulanic. Okay, why? Because the moment we do the surgical aggression to our patient, we already have antibiotic in blood. Okay, we have that kind of prophylactic antibiotic. We are going to continue the antibiotic therapy for at least 7 days. Why do I say at least? Because if we do a big surgery, a vertical augmentation, bilateral sinus leaf augmentation, we are going to prescribe antibiotics for 14 days. Do not be scared of prescribing antibiotics for 2 weeks. It doesn't happen anything. ENTs are used to prescribe antibiotics for really long periods of time. Okay, do not worry for those 14 days. We prefer 14 days of antibiotics than an infection. Okay, so 1 hour prior, we do a prophylactic antibiotic therapy with amoxicillin clavulanic, and we continue this antibiotics for 7 or 14 days. Depending on our patient, we will prescribe either 500, 125, or 875, 125. Okay? But what if our patient is allergic to penicillin? When our patient tells us that he has any kind of allergies, okay, that's big words for us. Okay, if we're doing minor surgery, just 1 implant, wisdom tooth, we're going to prescribe clindamycin. Clindamycin 300 every 8 hours. Okay, the thing is that what if our patient that is allergic to penicillins is going to go under a big surgery, okay? If our patient that is allergic to penicillin is going through a big surgery, bilateral sinus lift or vertical augmentation, we are going to treat him as if he was already infected, okay? And what do we prescribe him? We prescribe him ciprofloxacin 500 every 12 hours and metronidazole 500 every 8 hours. You may think that that's a lot of antibiotics, and you're right, it's a high dose, but we'd rather have our patients 7 days under a big dose of antibiotics than a huge infection in an allergic patient, okay? This same protocol, we will prescribe it when a non-allergic patient gets infected. That means we prescribe him augmentin amoxicillin plus clavulanic and he gets infected, because sometimes it happens. We rotate to ciprofloxacin and metronidazole, okay? That's most part of our protocol, okay? But you have to know that in our opinion, prescribing antibiotics is absolutely mandatory when doing surgery in the oral cavity. I know you will find papers saying that it's not absolutely necessary. In our opinion, in our protocols, yes, 100% of our patients go through an antibiotic therapy.
So, summarizing, pay attention that the non-allergic patients take their medicine, because sometimes they just take 3-4 days and that is not enough and we can have resistance in the future. Also, if they have some issues like diarrhea because of the antibiotic, because of the clavulanic acid, add some probiotics. And also watch out for women patients that they can have candidiasis. So we are giving fluconazole 150 milligrams one time. For allergic patients, as Jose said before, we always keep an eye on those. We treat them like if they were already infected with ciprofloxacin and metronidazole. And sometimes when we are doing sinus lift or being bone grafts, we keep the medications for 10 to 14 days just in case, because as you know, we want to avoid infections. If we have an infection, we are going to probably lose all the graft and it's going to be a nightmare for the patient.
Well friends, I hope you like this video. I hope you find it useful. If you like to follow our protocols, feel free to do it, and any kind of questions you may have, leave your comments. Always remember the scalpel in your hand and the prosthodontic work in your head. See you soon, guys.